trauma scoring system. So asking a few questions. So first one being, what is Glasgow coma scale? The components. The second question is, in case of the MES, what is the full form of MES scoring and what are the components? Second question. Next one, what is TRIS? TRISS. What are the components of this scoring and what is the expansion of this? So we'll find out all these answers and learn a lot more. So in case of firstly the revised trauma score RTS. So here the scoring, it goes up to 12, that is 0 to 12. So 0 is the minimal and the maximum is 12. So what are the components of the RTS? So the RTS, the components, it includes the Glasgow coma scale. Okay. Next one is the respiratory rate and next is the systolic BP, SBP. The next scoring we see is the Glasgow. So it's a Glasgow coma scale. So here the scoring, it goes up to 3 to 15. And what is the components? Components is, it is eye opening is a component. There is a verbal response as well as the motor response. So it's how you see, how you speak and how you move your limbs. The next one is the abbreviated injury scale, AIS. So the AIS severity score, it goes from 1 to 6. 1 is the minimal and 6 is, it is considered fatal. Then we move on to the injury severity score. It is known as the ISS. So the total score here is 3 to 75. And how is it calculated? It is calculated by summing the squares of the AIS scores. So it is squares. You calculate summing the squares of the AIS severity score for the 3 most severely injured body regions. Okay. So the scoring, it goes by, it is about 3 to 8 in case of the injury being minor. Next it is 9 to 16 in case it is moderate. And then it is 16 to 24 in case it is serious and greater than 25. And this is in case it is severe. It is severe as well as it is very critical. This is greater than 25. Next, in case of MES scoring. So what is the full form of MES? So MES stands for the mangled extremity severity score. Okay. So it is nothing but MES, mangled extremity severity score. So what is the components? Components is firstly the energy that caused the injury, energy which causes the injury, as well as the skeletal and soft tissue injury. Next, the component, it includes the limb ischemia. Then also the shock as well as the patient's age. To repeat, it was the energy that caused the injury, skeletal and the soft tissue injury. Next was the limb ischemia, then the shock and the patient's age. Then we look at the TRIS, TRISS. So TRIS stands for the trauma, T for trauma, and the injury severity score. So next is IRMA, is how the components go. So I stands for the injury severity score. Then the R, it stands for the revised trauma score. M is for the mechanism of the injury. So it is it can be blunt as well as the penetrating. Then comes A. A is nothing but for the age. So now answering the questions which we initially discussed. So the first one being, what is the Glasgow Coma Scale? So the Glasgow Coma Scale is, the scoring is from 3 to 15 and it goes by eye-opening, verbal and the motor. So eye-opening, it has a maximum of 4 scoring, here it is 5 and here it is 6. And for each activity, the scoring increases. So the higher the score, the better is the individual's performance. So the minimal score which can be awarded to the Glasgow scale is 3. So there is no situation the score will be less than 3. Next question what we asked was, in case of the mess, what is mess and what are the components? So mess is what we discussed. Mess is nothing but the mangled extremity severity score. This is nothing but mess. So what are the components of mess? So the components include, there is E for energy and it that caused the injury. So E for energy that caused the injury and the skeletal as well as the soft tissue injury. So L, it stands for the limb ischemia. S for the shock and P and A is for the age of the patient. Next, the third question which we saw, it is nothing but the TRIS. So it is nothing but TRISS, TRIS. It stands for the trauma and the injury severity score. So here the components, it includes IRMA. I for the injury severity score, R for the revised trauma score, then M for nothing but the mechanism of the injury. So it can be blunt as well as the penetrating, and A for the age. So to recap, TRIS is nothing but the trauma and injury severity score. It includes the ISS, that is the injury severity score. Next, the revised trauma score and the mechanism of injury, that is the blunt or penetrative, as well as the age.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.